If your doctor recently told you that your creatinine is climbing, or that your kidneys aren't filtering the way they should, I want you to stay right here, because what I'm about to share with you in the next 20 minutes could genuinely change the conversation you have at your next nephrology appointment. I'm Dr. David. I've been a practicing nephrologist for over 25 years. I have sat across from thousands of patients, men and women just like you, in their 60s, 70s, even their 80s, who came into my office worried, confused, and honestly, a little scared about what those lab numbers meant for the rest of their lives. And I understand that fear. A creatinine of 2.1, a GFR under 45, protein in the urine, waking up 3 or 4 times a night to use the bathroom. These are not small things. These are signs your kidneys are working harder than they should. And if nobody is talking to you plainly about what you can do on your own between appointments to support your kidney function, then this channel exists for you. Now here's what I want to ask you before we go any further. Did you know that in your kitchen right now, not at a supplement store, not behind a prescription counter, there are ordinary spices that have been studied in peer-reviewed medical literature for their ability to reduce inflammation in kidney tissue, support the body's natural detoxification pathways, and in some well-documented cases, meaningfully lower elevated creatinine levels? Not miracle cures, not magic powders, real spices. Spices that have been used for centuries in traditional medicine and that modern nephrology research is now beginning to validate in ways that genuinely surprise even experienced physicians like myself. Today, I am going to walk you through the top 5 spices that the scientific literature, including research referenced by sources like the National Kidney Foundation and studies published in journals I trust, suggests may help your kidneys work more efficiently. I'm also going to tell you something that almost no other kidney channel will tell you: the specific preparation mistakes that make these spices less effective, or in some cases, actually harmful for people with CKD. Because more is not always better, and the wrong form of the right spice can still cause problems. Stay with me through this entire video. The 5th spice on this list is the one that surprised me the most when I reviewed the literature, and it's probably sitting in your spice cabinet right now, completely overlooked. Let's get into it. Spice number 1, turmeric. The first spice we're talking about today is turmeric. And before you scroll past because you've heard about turmeric 100 times, I want you to hear what nephrologists are actually saying about it. Because most of what you've seen on YouTube about turmeric and kidneys is incomplete, and some of it is dangerously wrong. Turmeric's active compound is called curcumin, and what curcumin does at a cellular level is something that every CKD patient should understand. When your kidneys are under chronic stress, from diabetes, from high blood pressure, from years of inflammation, something called oxidative stress accelerates the damage. Oxidative stress is essentially what happens when the body's ability to neutralize harmful molecules, called free radicals, gets overwhelmed. Curcumin has been demonstrated in multiple studies to be a powerful antioxidant and anti-inflammatory agent. A 2020 study published in the journal Phytotherapy Research found that curcumin supplementation significantly reduced markers of inflammation and oxidative stress in patients with chronic kidney disease. The researchers noted improvements in creatinine levels and a reduction in the progression of kidney damage. Now, here is the part that almost nobody talks about. Raw turmeric powder, the kind you shake onto your food, has very poor bioavailability. That means your body absorbs very little of the curcumin when you eat it plain. The curcumin just passes through without doing much. But here's the fix, and it's surprisingly simple: black pepper. A compound in black pepper called piperine increases the bioavailability of curcumin by up to 2,000%, according to research published in the journal Planta Medica. 2,000%. Just a pinch of black pepper alongside your turmeric, and your body suddenly has access to far more of that anti-inflammatory compound. Here is how I recommend my patients use turmeric. A half teaspoon of turmeric powder combined with a small pinch of black pepper, stirred into warm water with a little honey, or added to a broth, a soup, or a vegetable dish, once daily. That's it. That's the preparation. Consistent, daily, modest use. not tablespoons, not turmeric capsules stacked on top of other supplements without your doctor's knowledge. And here is the critical warning I need you to hear. Turmeric is high in oxalates. Oxalates are compounds that can contribute to kidney stone formation, particularly in patients who already have a history of calcium oxalate stones. If your nephrologist has ever told you to follow a low oxalate diet, you need to discuss turmeric with them before adding it regularly to your diet. This is not to scare you away from turmeric. For most CKD patients without stone history, modest dietary turmeric is considered safe and potentially beneficial. But the dosing matters, and your specific case matters. This is precisely why I always say, use this video as a starting point for a conversation with your care team, not as a replacement for one. Spice number 2, ginger. Let me tell you about a patient I'll call Margaret. She came to see me about 3 years ago. 67 years old, stage 3 BCKD, type 2 diabetic, struggling with persistent proteinuria, and completely exhausted from waking up 4 times a night to urinate. She was frustrated. She felt like her body was betraying her. One of the first dietary conversations we had was about anti-inflammatory foods, and ginger was near the top of that list. Ginger, specifically its active compounds called gingerols and shogols, has a well-documented anti-inflammatory and antioxidative profile. But what makes ginger particularly interesting from a nephrology standpoint is its documented impact on diabetic nephropathy, which is kidney damage caused by diabetes. A randomized controlled trial, published in the Journal of Renal Nutrition, found that ginger supplementation in patients with type 2 diabetes significantly reduced markers of kidney inflammation and improved several kidney function parameters over a 12-week period. For a senior audience dealing with the combined burden of diabetes and CKD, which, by the way, is one of the most common combinations I see in my clinic, this is not a trivial finding. There is something else about ginger that rarely gets discussed in the context of kidney health, and I want to bring it up here because it addresses something many of you have written to us about: nocturia, or frequent nighttime urination. Nocturia in CKD patients is often related to the kidney's reduced ability to concentrate urine during the day, leading to fluid redistribution at night. While ginger is not a treatment for nocturia, its anti-inflammatory properties may support overall kidney tubular function over time, and several of my patients have reported improved sleep quality when they began consistent anti-inflammatory dietary habits, of which ginger was a component. Correlation, not causation, but worth noting. How do I recommend using ginger? Fresh ginger root is superior to powdered ginger when it comes to gingerol content, though both have value. Slice about an inch of fresh ginger root, roughly the size of your thumb joint, and steep it in hot water for 8 to 10 minutes to make a ginger tea. Drink it in the morning or early afternoon, not right before bed, because ginger can be mildly stimulating. You can also add grated fresh ginger to cooked vegetables, stir-fries, or soups. The key is regular, modest use, not concentrated supplements at high doses. One important consideration for our audience: ginger has mild blood-thinning properties. If you are taking warfarin, aspirin, or any other blood-thinning medication, discuss ginger with your physician before increasing your intake. At culinary doses, it is generally regarded as safe, but for those on anticoagulation therapy, even natural compounds deserve a second look. Spice number 3, cinnamon. I want to stop here for a moment and ask you something directly. If you've been watching this video and thinking, I've heard about turmeric, I've heard about ginger, this next one might genuinely surprise you. Because while cinnamon is beloved in American kitchens, sprinkled on oatmeal, stirred into coffee, baked into pies, its connection to kidney health is something most people have absolutely no idea about. And the mechanism is fascinating. Here is what happens in a body with uncontrolled blood sugar over time. Elevated glucose damages the small blood vessels inside the kidney, specifically in a structure called the glomerulus, which is the tiny filtration unit. Damage to these vessels leads to protein leaking into the urine, which you may recognize as proteinuria, or foamy urine. This is one of the earliest warning signs that kidneys are under diabetic stress. Now, cinnamon, specifically Ceylon cinnamon, and I'll explain why that distinction matters in a moment, has been studied extensively for its ability to improve insulin sensitivity and lower fasting blood glucose levels. A meta-analysis published in the Journal of the Academy of Nutrition and Dietetics concluded that cinnamon consumption was associated with significant reductions in fasting blood glucose, which is directly relevant to slowing the progression of diabetic nephropathy. But there is something even more specific to kidney health that most YouTube channels miss entirely. A study published in the journal Renal Failure examined cinnamon's antioxidant effects on kidney tissue in the context of oxidative damage, and found that cinnamon extract significantly reduced markers of kidney cell injury. The researchers attributed this to cinnamon's ability to upregulate the body's own antioxidant enzymes, including superoxide dismutase and catalase, which are naturally occurring protective compounds in kidney tissue that become depleted under chronic disease conditions. In other words, cinnamon may help your kidneys replenish their own defense systems. Now, the critical warning that I promised you. There are two main types of cinnamon sold in American grocery stores: Ceylon cinnamon, sometimes labeled true cinnamon, and cassia cinnamon, which is the most common variety found in American spice aisles. Cassia cinnamon contains significant amounts of a compound called coumarin, which in high doses has been shown to be toxic to the liver and kidneys. For a person with healthy kidneys, normal culinary amounts of cassia cinnamon are not a serious concern. But for someone with CKD, whose kidneys are already struggling to process and eliminate compounds from the body, consuming large amounts of cassia cinnamon daily could add an unnecessary burden. Ceylon cinnamon has very low coumarin content and is the variety I recommend specifically for kidney patients. Look for Ceylon cinnamon on the label. You can find it in most health food stores and online. 1/4 to half a teaspoon per day stirred into oatmeal, smoothies, or herbal tea is a reasonable starting point. It is not a substitute for blood sugar medication, but used consistently alongside a kidney-friendly diet, it may be a meaningful piece of the puzzle. Before we get into spice number 4, and trust me, number 4 and number 5 are where it gets really interesting, I want to take 30 seconds for something important. If this video is giving you useful information that you haven't heard from other sources, information that feels like what a real doctor should be telling you, then please hit that like button right now. Not for me. Hit it so that YouTube understands that this content is valuable and shows it to other seniors who are sitting at home worrying about the same lab results you are. Every like helps us reach someone who needs this. And we have a goal. We are working toward 100,000 subscribers on this channel because when we hit that milestone, we unlock the ability to bring in specialist guests, conduct more in-depth content, and serve this community even better. If you haven't subscribed yet, please do it now. Hit the subscribe button and the bell so you never miss a new video. Now, here is what I really want from you in the comments section. I want you to tell me your most recent creatinine level, or GFR, your age, and the state you're in, or your country if you're watching internationally. Something like age 68, creatinine 2.3, GFR 42, Texas. Why do I ask? Because it helps me understand exactly who is watching this channel, and it helps me create future videos that speak directly to where you are in your kidney health journey. Your comment could genuinely influence the next video we make, so drop it below. I read every single one. All right, spice number 4. This one comes from a part of the world where kidney disease rates are paradoxically lower despite high carbohydrate diets, and researchers have been trying to understand why for decades. Spice number 4, garlic. Garlic. I know what you might be thinking. Garlic is a flavor, not a medicine. But I want to reframe how you think about garlic entirely, because the research on garlic and kidney function is some of the most compelling I have encountered in the dietary nephrology literature. And it operates through a mechanism that directly addresses one of the most common complications my CKD patients face: high blood pressure. Let me explain the connection clearly. High blood pressure, hypertension, is both a cause and a consequence of kidney disease. It is a vicious cycle. Damaged kidneys struggle to regulate blood pressure, and elevated blood pressure accelerates kidney damage. This cycle is one of the primary drivers of CKD progression from stage 3 to stage 4 and eventually to stage 5. Managing blood pressure is therefore one of the most powerful levers we have for slowing CKD progression. Garlic's active compound, allicin, has been demonstrated in multiple meta-analyses to produce meaningful reductions in systolic and diastolic blood pressure, comparable in some studies to low-dose antihypertensive medication. A Cochrane-reviewed meta-analysis examining multiple randomized controlled trials found that garlic supplementation reduced systolic blood pressure by an average of 8.3 millimeters of mercury. For a CKD patient, that is a clinically significant number. But here is the layer of this story that almost nobody is talking about. A 2021 study published in the journal Oxidative Medicine and Cellular Longevity specifically examined garlic's renal protective effects in patients with early to moderate CKD. The researchers found that allicin reduced tubular damage markers, decreased urinary protein excretion, meaning it helped with proteinuria, and improved the kidney's antioxidant capacity. This is not a peripheral benefit. This is garlic directly interfering with the mechanisms of kidney damage. Now here is the preparation nuance that changes everything, and this is something I wish more people knew. When you crush or chop a garlic clove, an enzyme called alliinase converts a compound called alliin into allicin, the active ingredient. But heat destroys allicin rapidly. If you throw garlic into a hot pan immediately, most of the allicin is denatured before it can be absorbed. The trick, and this is backed by research, is to crush or chop the garlic and then let it sit at room temperature for 10 to 15 minutes before any cooking. During that waiting period, the alliinase enzyme completes its conversion, and the allicin becomes stable enough to partially survive mild cooking. Raw garlic in salad dressings or added at the very end of cooking preserves even more. This is a simple, specific, actionable step that makes a measurable difference in the therapeutic value of garlic. One important caution for our audience: garlic is a potassium-containing food. For CKD patients in stage 4 or those already managing hyperkalemia, elevated potassium levels, you need to be mindful of total potassium intake. In culinary amounts, garlic's potassium contribution is relatively modest compared to high potassium foods like bananas or potatoes. But if your nephrologist has placed you on a potassium restriction, have that conversation before dramatically increasing your garlic consumption. 1 to 2 cloves per day in food is a reasonable, generally well-tolerated amount for most CKD patients. Spice number 5, parsley. And now we arrive at spice number 5. The one I told you at the beginning of this video would surprise you. The one that is almost certainly sitting in your kitchen right now, probably used as a garnish that gets pushed to the side of the plate, completely overlooked. Parsley. I can hear some of you thinking, parsley? That green decoration on restaurant plates? Yes, and the research behind it, specifically in the context of kidney health and creatinine management, is one of the most underreported stories in dietary nephrology. Let me start with the mechanism that makes parsley unique among everything else we've discussed today. Parsley is one of the most potent natural diuretics studied in peer-reviewed literature, and not in a crude, dehydrating way like caffeine, but through a specific renal pathway. Parsley contains apiol and myristicin, compounds that increase urine flow by acting on the kidney tubules themselves, stimulating the excretion of sodium and water without significant potassium loss. A study published in the Journal of Ethnopharmacology examined parsley's diuretic mechanism and confirmed its ability to increase urinary output and facilitate the clearance of waste products, including compounds that contribute to elevated creatinine. For someone experiencing fluid retention, mild edema in the ankles, or the sensation of incomplete bladder emptying, which are common complaints among CKD stage 3 and 4 patients, this is a meaningful finding. But there is a second mechanism that I find even more compelling for our audience. Parsley is extraordinarily rich in apigenin, a flavonoid that has been studied for its anti-inflammatory and nephroprotective properties. Research published in the journal Phytomedicine found that apigenin significantly reduced kidney fibrosis, that is, the scarring that occurs in CKD, by inhibiting the activity of inflammatory signaling pathways at the cellular level. Kidney fibrosis is one of the primary structural changes that marks the progression of CKD. Anything that can slow that scarring process is worth taking seriously. Here is the preparation method that maximizes parsley's benefits. Fresh parsley, flat leaf, Italian parsley specifically, prepared as a tea or water infusion. Take a generous handful of fresh parsley leaves, roughly 1 cup, and steep them in 2 cups of boiling water for 5 to 8 minutes. Strain and drink warm. This parsley water can be taken once daily, in the morning. Alternatively, fresh parsley can be added liberally to salads, soups, and grain dishes. The key is fresh, not dried. Dried parsley loses a significant portion of its active compounds during the dehydration process. Now, and I want to be especially clear here, parsley contains a relatively high amount of vitamin K and is moderately high in oxalates. For patients on warfarin specifically, a sudden, large increase in parsley consumption can interfere with anticoagulation. This is not a reason to avoid parsley entirely, but it is a reason to keep your intake consistent and discuss it with your prescribing physician. For patients with a history of kidney stones, particularly calcium oxalate stones, the oxalate content in parsley warrants a conversation with your nephrologist before you begin drinking parsley water daily. These are real considerations, and the fact that this is a natural food does not exempt it from pharmacological interactions. For most CKD patients without these specific contraindications, modest daily use of fresh parsley is among the most overlooked and underutilized dietary tools available. The science behind the strategy, putting it all together. Now I want to take a few minutes to step back and talk about something that goes beyond any individual spice, because I think the most important insight I can offer you today is about how these spices work together, and why the concept of cumulative, consistent, modest intervention is so much more powerful than a single dramatic change. In nephrology, we talk about a concept called renal reserve, the idea that your kidneys have a certain capacity beyond what they need at baseline, a buffer. In healthy kidneys, that buffer is substantial. As CKD progresses, that reserve shrinks. What these 5 spices share, turmeric, ginger, cinnamon, garlic, and parsley, is that each of them works on a slightly different inflammatory or oxidative pathway. Turmeric inhibits NF-κB signaling, a master regulator of inflammation. Ginger modulates prostaglandin synthesis. Cinnamon upregulates endogenous antioxidant enzymes. Garlic's allicin reduces nitrosative stress and supports endothelial function in the kidney's blood vessels. Parsley's apigenin inhibits TGF-beta, a key driver of fibrosis. What this means practically is that you don't need heroic doses of any single compound. You need modest, consistent, strategic variety. The synergy between these agents, each targeting a different aspect of the inflammatory and oxidative burden on kidney tissue, may collectively have a greater effect than any one of them alone. This principle is supported by the emerging field of nutraceutical nephrology, which is gaining credibility in academic medicine, though it is important to acknowledge that large-scale clinical trials specifically on combination dietary intervention in CKD are still limited. We are working with the best available evidence, not absolute certainty, and that distinction matters. I also want to address something that I hear in my clinic regularly, and that I suspect many of you have experienced. There is a tendency when you receive a difficult diagnosis like stage 3 or stage 4 CKD to feel as though everything is now out of your control, that the progression is inevitable, that the only tools are medications and dialysis. And while medications absolutely have their place, and I prescribe them every day, the dietary and lifestyle factors that influence kidney health are genuinely significant, and they are within your control. Research consistently shows that diet quality, inflammation burden, and blood pressure control are among the most powerful modifiable factors in CKD progression. The spices we've discussed today are not side stories. They are part of the main intervention. One more insight I want to leave you with that rarely surfaces in popular kidney health content: the gut-kidney axis. Emerging research is revealing a bidirectional relationship between the gut microbiome and kidney function. Many of the uremic toxins, the compounds that accumulate in the blood as kidney function declines, contributing to elevated creatinine and overall toxin burden, are actually produced in the gut by specific bacterial species. Turmeric, ginger, and garlic all have well-documented prebiotic and antimicrobial properties that positively influence gut microbiome composition. By supporting a healthier gut environment, these spices may indirectly reduce the production of uremic toxins before they ever reach the kidneys. This is a frontier area of nephrology research that I am watching closely, and I believe it will fundamentally shape how we think about kidney-supportive diets in the coming years. Common mistakes to avoid. Before we close, I want to talk about the mistakes I see most often when patients take this kind of information and try to apply it on their own. Because good information applied incorrectly can still cause harm. The first and most common mistake is supplementation at high doses. There is a critical difference between using turmeric, ginger, cinnamon, garlic, and parsley as regular parts of a balanced diet, which is what I've been describing, and purchasing concentrated supplements at 5, 10, or 20 times the dietary dose. At very high supplemental doses, some of these compounds can stress already compromised kidney filtration, contribute to electrolyte imbalances, or interact with medications including immunosuppressants, blood thinners, and diabetes medications. Food as medicine is the framework here, not supplements as drugs. The second mistake is expecting rapid, dramatic change. Creatinine levels are influenced by muscle mass, hydration status, protein intake, and many other variables. Dietary changes produce gradual, cumulative improvements in inflammatory burden and kidney function markers over weeks and months, not days. Patients who don't see a change in their creatinine after 2 weeks and give up are abandoning a strategy before it has had time to work. The third mistake, and this is one I feel strongly about, is using this or any other online health content as a reason to delay or skip appointments with your nephrologist. These spices do not replace your ACE inhibitor or ARB. They do not replace dialysis if you need it. They do not replace regular monitoring of your GFR, creatinine, potassium, phosphorus, and other kidney function markers. The right framing is additive. You are adding dietary tools to an existing care framework, not substituting one for the other. And the fourth mistake, not individualizing. Every CKD patient is different. Your potassium restriction, your phosphorus restriction, your fluid allowance, your medication list, all of these create a unique context that determines which of today's recommendations are appropriate for you specifically. Use this video as a launching point for a conversation with your nephrologist or a registered renal dietitian. Bring this information in, ask questions. That is the right way to use content like this. Final takeaway. I want to close with something personal. 25 years in nephrology has taught me many things, but perhaps the most important is this: the patients who do best, not just medically, but in terms of quality of life, hope, and resilience, are the ones who stay engaged. They ask questions. They don't just accept the diagnosis as the whole story. They look for every legitimate tool available, and they use those tools consistently, patiently, and wisely. You are watching this video because you are that kind of person. You care about your kidneys. You care about staying well. You care about being present for your family, for your grandchildren, for the life you've built. And that matters. That determination is itself a clinical variable. I have seen it make measurable differences in patient outcomes over and over again throughout my career. The 5 spices we talked about today: turmeric with black pepper, ginger, Ceylon cinnamon, garlic prepared correctly, and parsley, are not going to reverse advanced kidney disease overnight. I will not tell you that. But used consistently, wisely, within the context of a kidney-friendly diet and in coordination with your medical care team, they represent real, science-supported tools that may help slow the inflammatory burden on your kidneys, support healthier creatinine trends over time, and give you something important: a sense of agency over your own health. That agency is not small. It is everything. If you found value in this video today, please share it with someone you know who is dealing with kidney disease: a spouse, a sibling, a friend from church, or from your community who mentioned recently that their kidneys aren't working right. You might not know it, but sharing this video could genuinely impact someone's health trajectory. Like this video, subscribe to this channel, and drop your comment below: your age, your most recent creatinine or GFR, and your location. Let us know you're here. Let us know what you need. This channel exists for you, and every comment tells us we're on the right track. In the next video, we're going to cover the 5 foods that CKD patients over 60 are eating every day that are silently raising their creatinine, and number 3 is going to shock you. Make sure you're subscribed so you don't miss it. I'm Dr. David. Thank you for trusting me with your time today. Take care of those kidneys, and I'll see you in the next one.